I think there are at least two research unmet needs. One is to find out exactly what the mechanisms are that are driving progression independent of inflammatory activity. We are now starting to realize that CNS resident cells, including macrophages and microglia, are important, and we know the importance of smaller inflammation, slowly expanding lesions, and how they contribute to progression. We are now having trials of a class of substances, of drugs, which are the BTK inhibitors, that promise to tackle this problem. I'm not sure whether these drugs will be the final solution, because I think there are other drivers of inflammation that we are not tackling, including metabolic alterations in resident cells, and also, for instance, astrocytes. So I think we should look more carefully into other cells, including astrocytes, because they might be driving also progression, and we are not there yet. So one thing is understanding what drives progression and trying to find solutions to address this. Second problem is when we diagnose a patient, trying to have good predictive models of what's going to happen with the patient, so that we can tailor the treatment strategy and the management strategy to that patient. We are seeing in this conference particularly a lot of research groups trying to develop models that can predict. The problem is that most of these models are too complex and use many different parameters, and those that are simple to use are not predictive enough. So again, we have here a problem, but I think that in the next few years, using, for instance, other markers that are not yet easily available, including neurofilament light levels, we might be able to predict with a high degree of precision what will be the future of these patients, and try to tailor the treatments to the individual patient risk. These are the two questions. Then there's a third one which I would like to highlight, which is regarding the implementation of the knowledge we have. So I think we have a lot of knowledge, for instance, regarding the importance of treating early with high efficacy drugs, but this is not being translated easily into the clinical practice. So we still see many patients being treated with moderate or low efficacy drugs, even when they were clear candidates to high efficacy drugs. And I think this is also a gap that we need to fill. And I think that research organizations, ECTRIMS, other professional organizations should address these in more, in the deepest way. Because I think we are overlooking this problem, and we are producing new research and new developments, but in many parts of Europe, and of course probably also the wider world, we aren't still there implementing what we know. So we need to know more, but it would be good if we could implement now what we already know.